is the New York Living Health and Fitness Report.
New estimates show throughout the country there are far more people infected with HIV and AIDS each year than originally thought. As our health reporter Kafi Drexel reports, the new figures could spark renewed dedication to finding a cure.
More than 55,000. That's more people than you can seat in the new Yankee Stadium in the Bronx. It's also the latest estimate from the Centers for Disease Control on just how many people in the United States are newly infected with HIV every year.
Our new estimate shows that the epidemic is and has been worse than we previously knew.
In fact, the number reflects a more than 40% higher infection rate than the previous estimate of a little over 39,000 new cases each year. Health officials say they were able to come up with the more accurate estimate by using new lab technology that can distinguish more recent HIV infections from older ones. In 2006, the study showed approximately 56,300 new infections. Not only is that a much larger number than earlier estimates, but the research indicates the crisis is still disproportionately affecting certain groups. 45% of those cases were among blacks, and 53% occurred among men who have sex with men.
The importance of the study, it is not that all of a sudden there's been a tremendous increase in HIV infection, but the critical point is that we now know how to count the number of new HIV infections. So instead of guessing, we can actually measure the number of new infections. What is most concerning to me about this higher number is that it demonstrates yet again what a poor job we do in terms of preventing this infection, which is entirely preventable.
Researchers at the Centers for Disease Control say this more accurate data can be used to make sure that HIV prevention resources go toward the populations in the greatest need. And groups like the Gay Men's Health Crisis say they want to make sure that happens.
We have to do more, especially with regards to implementing a national AIDS strategy that makes sure that we get the right funding and the resources and the budget needs, and also the focus on quality prevention and care services all round.
And with researchers saying they now have the clearest picture to date on just how many more new cases of HIV are occurring each year, there are sure to be a lot more voices using it as a call to arms for action. Kafi Drexel, New York 1.